Thank you, Mr. Chairman. Madam Secretary, so much of the original promise of the Affordable Health Care Act has been undermined by faulty implementation that has sometimes been indifferent to local concerns. Last month, the Congressional Budget Office, as you know, concluded that faulty implementation of the health care law, quote, impeded so many people's enrollment in exchanges that 1 million fewer people will actually obtain exchange coverage this year than they previously projected. From your testimony this morning, it's clear we will not have 7 million or even 6 million. And of course, the number that's really important is not how many people have enrolled, but how many people have paid their premiums and are actually getting an exchange-based coverage, a number we've never been given. As you're aware, since last August, I've been voicing concerns to your office about implementation in Texas. At best, less than 10% of exchange-eligible Texans have selected a plan. In other words, more than 90% of the people whom we wrote this law to get exchange coverage have not been covered. It would, to meet your projections, we would need to enroll and have premiums paid for as many people this month as have been enrolled since the beginning in October to yesterday, or last week. This is much more than a website problem, though I believe that the individual assistance program there has been handled with about the efficacy of the original website rollout. I've been unable to get straight answers about even who is responsible for coordinating in-person assistance in Texas, a place where we have multiple assisters in some areas and none in many others. I have sought to get even just a dedicated line so that the certified counselor who yesterday had put in 10 hours trying to help one person would be able to call a line dedicated to assistance counselors to be able to get prompt assistance and help people get enrolled in this. But there's been no response from HHS or CMS about that. It seems to me that we're to a point where instead of just circling the wagons against all the political arrows that are shot against this plan, we need a little more accountability, and we need to ensure that the next enrollment period is not handled as poorly as the last one. I'm very interested in answers to the questions that the chairman raised at the beginning of this hearing. We haven't gotten them yet, and I hope that we do get them. We come at this from a different perspective, but taxpayers deserve to get their money's worth. And I think much of the focus as it relates to in-person assistance needs to be defined. And I assume, Mr. Chairman, that some of these questions I've been raising since last fall can be submitted by you with your questions for prompt answers, such as how much it costs us per person who's actually insured through the exchange for some of these contractors that have been providing these services. 2 Washington Beltway contractors have been paid $9 million for in-person assistance in Texas. I've been unable to find out what it costs per enrollee for those persons. And so I think that while our goal should be to try to improve and strengthen this act, if it is to perform any better in the next enrollment period than it has in this one, we need answers to these questions to get the taxpayer their money's worth and to get the promise of this act fulfilled. And I yield back.